Polycythaemia rubra Vera. PRV occurs mainly in patients over the age of 40 years and presents either as an incidental finding of a high hemoglobin or with symptoms of hyperviscosity, such as lassitude, loss of concentration, headaches, dizziness, blackouts, pruritus, and epistaxis. Some patients present with manifestations of peripheral arterial or cerebrovascular disease. Venous thromboembolism may also occur. Peptic ulceration is common, sometimes complicated by bleeding. Patients are often plethoric and may have a palpable spleen at diagnosis. Investigation of polycythemia is discussed on page 925. The diagnosis of PRV now rests on the demonstration of a high hematocrit and the presence of the JAK2 V617F mutation, positive in 95% of cases. In the occasional JAK2 negative cases, a raised red cell mass and absence of causes of a secondary erythrocytosis must be established. The spleen may be enlarged and neutrophil and platelet counts are frequently raised. An abnormal karyotype may be found in the marrow. An in vitro culture of the marrow can be used to demonstrate autonomous growth in the absence of added growth factors. Now, management and prognosis. Aspirin reduces the risk of thrombosis. Venesection gives prompt relief of hyperviscosity symptoms. Between 400 and 500 ml of blood, less if the patient is elderly, are removed, and the venesection is repeated every 5 to 7 days until the hematocrit is reduced to below 45%. Less frequent but regular venesection will maintain this level until the hemoglobin remains reduced because of iron deficiency. Suppression of marrow proliferation with hydroxycarbamide or interferon alpha may reduce the risk of vascular occlusion, control spleen size, and reduce transformation to myelofibrosis. Intravenous P32, which is reserved for older patients as it increases the risk of transformation to acute leukemia by 6 to 10-fold, is rarely used now in Europe and North America. Median survival after diagnosis in treated patients exceeds 10 years. Some patients survive more than 20 years. However, cerebrovascular or coronary events occur in up to 60% of patients. The disease may convert to another myeloproliferative disorder with about 15% developing acute leukemia or myelofibrosis.